Questions 961 to 980. 961. A nurse is inserting a nasogastric tube for a 65-year-old patient with paralytic ileus. Immediately after insertion, 200 milliliters of milky-appearing drainage was noted in the bag. The nurse is not sure if the distal end of the tube is in the stomach. What is the most appropriate technique to confirm positioning? A. X-ray of stomach. B. Check pH of drainage. C. Aspirate more fluid and check if the color change. D. Flush with 100 ml saline and auscultate over the stomach. The answer is A. X-ray of stomach. 962. A patient who had aortic valve replacement with a mechanical heart valve has just completed discharge teaching provided by a nurse on duty. Which statement by the patient indicates the effectiveness of the nurse's teaching? A. I am glad that I can continue taking my ginkgo biloba. B. I will increase my intake of green and yellow vegetables. C. I will start applying vitamin E to my chest incision after showing. D. I will shave using an electric razor from now on. The answer is D. I will shave using an electric razor from now on. 963. Height of enema is? A. 50 centimeters. B. 150 centimeters. C. Below red edge. The answer is A. 50 centimeters. 964. A 67-year-old patient was brought to the emergency room with history of diabetes mellitus, hypertension and heart failure, complaining of acute shortness of breath and productive cough. The sputum was pink and frothy. During the assessment, the nurse noticed crackles and wheezes. Blood pressure 80/45 mm of mercury, heart rate 124 per minute, 36 per minute respiratory rate, 36.5 degrees Celsius temperature. Which of the following disorders should the nurse suspect? A. A pneumothorax. B. Unstable angina. C. Pulmonary edema. D. Pulmonary embolus. The answer is C. Pulmonary edema. 965. A physically handicapped young woman uses a wheelchair to adapt with her problem. She had a neighbor who repeatedly tell her that she might did a fault and for that she has been punished from God. Which model of disability does this attitude belongs to? A. Moral. B. Medical. C. Disability. D. Rehabilitation. The answer is A. Moral. 966. Disability patient already on the wheelchair has visited by her nephew. Her nephew responds to the patient that she has done something wrong and that God punished her and become in this condition. Which of the following describing her nephew behavior? A. Moral. B. Anger. C. Abuse. The answer is C. Abuse. 967. A 62-year-old diabetes type IL patient is in the post-operative care unit following amputation of the right foot. Post-operatively, the patient tells the nurse of tingling, coldness and cramping in the right foot. Which of the following describes best the type of pain? A. Visceral. B. Somatic. C. Ischemic. D. Neuropathic. The answer is D. Neuropathic. 968. A 16-year-old man is in the emergency department with nose bleeding as a result of falling down while climbing up the wall. On assessment, his nose appears slightly deviated and too swollen. He is breathing from his mouth. What sign helps evaluate that his nose is still bleeding? A. Complain of sharp pain in the nasal bone. B. Experience more difficulty in breathing. C. Patient is swallowing frequently. D. Increased swelling of the nose. The answer is C. Patient is swallowing frequently. 969. 25-year-old woman has a family history of breast cancer. The nurse reviews the procedure for breast self-examination, BSE, and tells her that the best time for a woman to perform a breast self-examination is A. A few days before her period. B. During her menstrual period. C. On the last day of menstrual flow. D. 3 to 7 days after the beginning of her period. The answer is D. 3 to 7 days after the beginning of her period. 970. The nurse is instructing a female client how to do breast self-exam. Which of the following is the best time to perform this exam? A. After ovulation. B. After period. C. 2 weeks after period. D. 3 days before period. The answer is B. After period. 971. Mass media disadvantage? A. One-way communication. B. Two-way communication. C. Large number of people. The answer is A. One-way communication. 972. In nursing is given education to a patient with blood pressure 170/95 to avoid eating of which of the following? A. Canned food. B. Protein. C. Vegetables and fruits. The answer is A. Canned food. 973. A nurse is giving health education to 32 years old female to prevent uterine prolapse. The answer is Kegel exercise. 974. A patient has depression and on antidepressants medication. While the nurse carrying him, he asked how long the medication takes to reach the effectiveness. The proper nurse response is A. 3 to 4 days. B. 10 to 14 days. C. 14 to 18 days. D. A month. The answer is C. 14 to 18 days. 975. A 25 years client is admitted to the emergency department with sudden onset of right lower abdomen pain. Which of the following physician orders should the nurse question at this time? A. Apply heating pads to abdomen. B. Obtain abdomen X-ray. C. Start intravenous dextrose 5%. D. Nothing by mouth. The answer is A. Apply heating pads to abdomen. 976. In anticipate of further emergency treatment for a client with salicylate overdose, which of the following medications should the nurse have available? A. Vitamin K. B. Atropine sulfate. C. Dextrose 50%. D. Sodium thiosulfate. The answer is A. Vitamin K. 977. Contraindication immunization for a patient who is receiving which medication? A. Steroids. B. Insulin. C. Midazolam. The answer is A. Steroids. 978. Radon cancer mostly affected? A. Lung. B. Cervical. C. Prostate. The answer is A. Lung. 979. Post-MI medication? A. Heparin. B. Aspirin. C. Warfarin. The answer is B. Aspirin. 980. A nurse researcher wrote in her explanatory statement, the researcher will 35 use a questionnaire to measure nursing job satisfaction. Which ethics principle is the researcher addressing here? A. Justice. B. Beneficence. C. Confidentiality. D. Non-maleficence. The answer is A. Justice.